Hello, Abdulapo Social Hub here. Welcome to my channel. For whole subscriber, thank you for still continuing to stay as a subscriber, even though my video has not been consistent. For my new subscriber, thank you. Please hang on. So I'm just a new YouTuber and I'm still having difficulty in trying to balance social social media, YouTube live, and my work and personal life. So please do bear with me. So where have I been? Well, I recently changed role. I'm still working in mental health and addictions, but I recently changed role from my job title, that is youth services. So I'm a mental health social worker for children and youth. Now I'm mental health counselor for adults. However, I still have children, youth, and adults on my caseload. So so today I'm just gonna talk about what is my role as a mental health social worker. What do I do? Like mental health social worker, how does my what do I do in my role? Yeah, so grab yourself a cup of coffee or tea or snack, and then let's get started. So the first thing I'm going to talk to you about in terms of mental health social worker role or mental health clinician is assessment, or some people call it intake, right? So assessment is it usually happen when we get a referral. It can be self-referrals, it can be a referral from the doctor, or it can be a referral from a dietitian and or any other agency. And then after we receive the referral, we will call the patient or the client, and then we book an intake appointment for you, for them. So that intake appointment usually involved like taking background information, their address, their PO box, their emergency contacts, if they've received services before in the past. For example, maybe they've seen a private practice or they've accessed services in the same area. So that they can just go back to their old file and see if it's going to be helpful in their current service, in their new services that they are requesting. So intake appointment also involve doing like an assessment. So that is suicide risk assessment, which involves asking about suicide, self-harm, substance use, suicide attempt history, substance use history, as well as maybe there's a failed attempt, suicide attempt, stuff like that. So an assessment or intake appointment is important for you to determine the risk of the client. For example, it can be a low risk, medium or moderate risk, or high risk, or no risk at all, right? But you need to have like a conversation with the patient or client, and try to figure out what is going on that they are needing mental health services. So I'm just going to give an example. For example, a referrer might say that somebody was just diagnosed of an illness or something. It can be medical illness, it can be mental illness, and that person is struggling with the news of their new diagnosis. So oftentimes the referral person will ask for consent for him or her to do a referral, and then we will get a referral. And so usually the appointment will involve lengthy conversation about what is going on, and then how, like, you will ask the client how would they like to be supported, right, in receiving services. And then that will come out with a plan of maybe counseling every 2 weeks, or counseling every week, wellness check. For example, if they are currently suicidal, you might want to do wellness check. You might want to do a reassessment of their risk, of their suicide risk assessment, stuff like that. So that is the first thing that we do: assessment, assessing risk of so I'm just going to note something. In when you're doing suicide risk assessment, it is important to know that assessing a client's risk of suicide does not necessarily guarantee if the client or if the person is gonna die by suicide, just for you to know. Mind you, that risk is just based on what is client, it's based on what the client is telling you, their substance use, and also if they have access to resources, community support, and their family and friends. So that will tend to increase their risk or reduce their risk of self-harm, of struggling. Yeah, so we'll leave it at that. The second one is reassessment, which I've talked about a bit. So reassessment is when, if a client is at risk of suicide, is a low risk, moderate risk, or high risk, there's need for you to reassess how that person is doing. Are they doing better? Like, did they rate from moderate to low, or did they rate from moderate to high risk? So depending on what the assessment outcome is, you might want to do more kind of like crisis intervention stuff by maybe sending them to the emergency department for physician assessment, or you might want to do like safety planning, if you think that they are safe to stay home, somebody watching them 24/7, or you can maybe transfer them to a shelter if they are homeless, if there's other things going on. That will determine what you're going to do. Of course, with the client, with the person, you need to make sure that you are planning with the person, because it's about, you want to give them the autonomy to make decision about their own health and need for service. So another thing that we do for my job is consultation. So sometimes we go downstairs. So I work in the hospital right now. So sometimes we go to the emergency department. Right now we have a medical social worker. So if, let's say, the medical social worker is on leave, or and the emergency department need to consult with her in terms, if a patient comes in for overdose or substance use, or suicide attempt, stuff like that, it's automatically we will get a consultation phone call from emergency department. So my job is to go to the emergency room and see the patient and do a risk assessment, give them my business card, as well as have conversation with them about a discharge planning, what they would like to do, and stuff like that. Yeah, so the third one is assessing like needs assessment. For example, I've seen a client come to my office, I see them, and I see that there's other things going on, like other social determinants of health, like housing, low income, like poverty, homelessness, stuff like that. It is very difficult for you to provide services for somebody that is homeless. They don't have a phone, they don't have a place to shelter and stuff like that. So depending on the resources that you have in your community, you can do a referral by calling the shelter or housing, temporary housing, and stuff like that. That's one of the things that we do as well. The other one is psychoeducation. So in my role, I do a lot of psychoeducation in terms of harm reduction, educating them about their medication, importance of taking their medication, because sometimes clients discontinue their medication like when they are feeling better, or because of side effects. So it is important for you to educate clients that before they stop their medication, they need to consult with their psychiatrist or the family doctor, and then their family doctor, they can go from there. There's also psychoeducation in terms of their diagnosis, like depression, schizophrenia, or bipolar disorder, or whatever their diagnosis may be. There's also psychoeducation around that as well, in terms of how are they coping, different kind of coping techniques, what is working for them, what is not working for them, importance of trying new things, self-care, and stuff like that. Yeah. So the majority of my work is done counseling. So actually talking to the clients about their presenting concern, such as depression or anxiety or trauma and sexual abuse, difficulty relationship, difficult family dynamic, and more, right? Sexuality, and yeah. So basically, for counseling, there are different approaches, different approaches to counseling. There is cognitive behavioral therapy, there's narrative therapy, there's DBT, lots of different approaches, trauma informed care into counseling and stuff like that. In my own practice, I often use cognitive behavioral therapy a lot, and the reason why I use it in as an approach in my counseling is because it is very, very effective. According to research, is effective in treating a lot of mental illnesses that our clients, people struggle with. Not necessarily our client, just like people can struggle with. So CBT is also good because you can use it for sure. It's very effective short-term therapy. You can use it either you're taking medication or you're not taking medication. So a lot of people can see a counselor. They might be on medication, they may not be on medication. It is totally up to them what they want, because different things or multiple things work for different people. So it is not a bad idea to try counseling with medication, or and if medication is not working for you, also try counseling as well. Some people just come to counseling just to talk, which is talk therapy. They want to talk about an experience that is frustrating to them, and how that frustrating thought can just be slide away, and they want to rub mind with other people in terms of that experience, which is also okay, right? Especially if you are alone, you are living alone, you don't really have families or friends or phone, social media and stuff like that. You want that human connection, that is fine as well. So that is my role. That's basically what I do. The last one, which I think I spend time, most of my 25% of my time doing, is actually administration and crisis intervention as well. So administration kind of typing letter for maybe you need your client to go to consult with a psychiatry or whatnot. I need to write a letter. If I need to write a letter of attendance for a client that's seeing me because they took a day off from work and stuff like that. I need to write case review letter if I'm trying to close a client that is not attending an appointment. And then the next one is kind of actually documenting the service. For example, you need to document how each appointment, how the appointments go. In that way, you are also able to track the progress of your client. And the last one is crisis intervention. So sometimes your clients may call you and leave you a voicemail and say, oh, I'm having that thoughts and I just feel like I want to talk to you right now because I'm having a suicide thoughts, and it's always awful when I talk to you. Or maybe they text you, I'm killing myself right now. And you saw that, you might want to respond to that right away, by getting the client help, maybe picking them up, dropping them in the emergency department, or calling their family, the emergency contacts that they have on their file. So that's kind of wraps it up in terms of what I do on a daily basis. If I have time, I'll probably do a day in my life at work, if I'm able to do that, so that you can kind of have an idea of how what I do at work itself. I will not show you client or any confidential information, of course, but if you feel like there's more that you do, if you're a mental health social worker and you feel like there's more that you do at work that I did not mention, please just put it in the comment section below. I am looking forward to uploading more video in the future. I'm just struggling with kind of managing time right now, and then I had to prioritize what is kind of like important right now. Yeah, if you have any question, please email me. I will still upload more video this in the coming weeks about some of the questions that I've been having on my Instagram account or on the comment or my email in a couple of weeks. Well, thank you for subscribing. Thank you for watching my video, for sharing, for liking, for commenting. I really appreciate you all. You guys have been pushing me to just be on top of posting video and doing what I like to do. Well, until next time, talk to you later. Mwah, mwah.